Hello everyone, welcome to another video by Study Nursing by Sense Girls. Today in this video we are going to discuss about one of the sought after questions asked in almost all of the nursing exams. It is nothing but healthcare associated infections, or otherwise called as nosocomial infection, or simply HAI. So in this video we are going to discuss about what exactly is HAI and what are the types and what all are the preventive measures you can take as a healthcare professional. So in this simple video, we are going to make it a really short and brief, but let me know in the comments if you require any of the detailed video of the conditions discussed in the slides. All right. So that brings us to the definition. So according to European Center for Disease Prevention and Control, it is defined as the infection acquired by the patient during their stay at a hospital or another healthcare setting. So when we talk about another healthcare setting, it could be a nursing home, it could be a rehabilitation center, or anywhere the patient receives a treatment, I would say. Or simply, you can understand this concept by imagining a point where the patient gets admitted for the procedure or any of the treatment and they develop the infection during their stay. So this is what we call as nosocomial infection, or HAI. So throughout the video, I might be using nosocomial or HAI or healthcare associated infection. So you can understand these are all the synonym of a single term. All right. Let's move to an interesting statistics by WHO. So according to their data published in the year 2022, it's quite critical, I would say. I'm not sure if it has come down or increased. If I were to comment, I would say it has come down due to the improved infection control measures that we take in the hospital. However, keeping my opinion apart, let's see the statistics. So, out of every 100 patients in an acute care hospital, when we talk about high income countries, every 7 patients get HAI, whereas low income and the middle income countries, every 15 patient, that is double, gets the infection. And unfortunately, one in every affected patient lose their life. Um, yes, so did you know that 50% of healthcare associated infections are preventable? So that's a wonderful data. And that also means, as a healthcare professional, we've got a primary role in preventing such infections. So at the end of the video, we will sum up what all things you can do to prevent such infections. And you will not believe me, they are as simple as you can imagine. All right, so let's see in detail what are the types of HAI. To begin with, urinary tract infection, surgical site infection, ventilator associated pneumonia, bloodstream infection, and C.Diff. So these are the five infections we are going to discuss brief in this video. Let's jump to the first one. So urinary tract infection is the most common type of nosocomial infection we can find, and out of that, catheter associated infection is the 75% of the UTIs developed in the hospital are associated with the urinary catheter, and it is the most commonest form of complication when it comes to vulnerable patient, that includes elderly. All right. Let's move to the surgical site infection. So as the name indicates, it's the infection that a patient develops during, due to the procedure, due to the incision, or due to any cut or impaired tissue integrity due to the surgical procedure that is done on the patient. So it could be due to a faulty aseptic technique where they are not, following the aseptic technique during the procedure, or even after the procedure, the wound care is not done in a proper way or intended way. So in those cases, the microorganism enters the body through the impaired tissue. All right, through the cut or the broken tissue. So this is what we call as surgical site infections. The Next one, or the third one, is ventilator associated pneumonia. It occurs in the patients that have been on ventilation or mechanical ventilation for more than 48 hours, and it's usually characterized by purulent discharge. The patients may develop fevers, respiratory distress. So we can understand already the patient is compromised and they require active support of machines, and that's why they literally been ventilated. And just imagine if they are on the machines, the very machines actually um, is infected, isn't it? So the patients actually develop the infection, and it's quite complicated. And at least in my clinical experience, I would say it's a very fatal condition. And almost all of you who are listening to the video also can agree with me. It's a fatal condition, and we try our best to avoid VAP in patients on ventilator. All right, next we come to the bloodstream infection. This is same as the other conditions we have described. It's self-explanatory. So the microorganisms enter into the bloodstream, and the bloodborne pathogen causes blood poisoning, which is otherwise called as septicemia, and that causes infection. All right, so that manifests as infection, that causes a lot of complication, out of which the CLUBSI, or central line associated bloodstream infection, is the most common one. As we have discussed in case of VAP, this is also a highly complicated situation. And I would say I had a personal experience in my life that one of my family members had the complication and had a bad prognosis. So central venous bloodstream infection is also healthcare associated infection. The patient develop infection due to the procedure, due to the device which is present, or which was inserted during their stay at the hospital. All right. um, that brings us to the fifth and the last one, which is Clostridium difficile. Most of you might have heard about it, but those who are new to this infection, I would say it's caused by Clostridium difficile. It's a rod-shaped bacteria that causes inflammation due to the production of toxins in the intestine. It's usually caused by the prolonged use of antibiotics. It could also be caused by prolonged use of proton pump inhibitor such as omeprazole. um, um, this is highly contagious, actually. So why we call this as a nosocomial infection is, imagine the patient has a C.Diff, and if they have the C.Diff, at least in my experience, what I've seen is they could really be getting repeatedly. And if they have the infection, the as a healthcare worker, when you nurse that patient and when you don't do proper hygienic practices, including hand hygiene, or PPI, or personal protective equipment, you could usually be transmitting the infection for yourself and to your family as well as to the other patient. And imagine if you are having a vulnerable patient in your unit, you could really be complicating. And there has been situation where the entire unit in the hospital was infected by this particular infection. So let's be careful that we take adequate measures. So we have seen five different healthcare associated infection. Now let's see in brief what all are the preventive measures. As I've told you earlier, it's as simple as you can imagine. The first one begins with the use of personal protective equipment. That includes the use of gloves, use of mask, and disposable gowns whenever it is intended. And most importantly, hand hygiene. You could vouch for hand hygiene because of the uses, the benefits, the advantage that it plays in preventing the diseases. So ensure that you wash the hands regularly. And also, you could use a strict aseptic technique when you're carrying out procedures, including the insertion of central venous line or insertion of PICC line, or insertion of catheter, urinary catheter, or a nursing for a patient who is on ventilator. So you could make sure that you are practicing strict aseptic technique, or even in any of the procedures that includes um, 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 that requires the use of aseptic technique, which could be a simple procedure such as a biopsy, and you're assisting the doctor. So in whatsoever cases, make sure that you are maintaining that technique which is intended, so that they control the infection, so that they bring down the HAIs. And at the end, you can also see an image of waste disposal. So at the same time, environmental infection control measures are also important, so as to make sure that our patients stay safe during the hospitalization. So, with this, I hope you have understood the concept of healthcare associated infections. What could be the other names? You can recall what all synonyms that I've told in the video. You have also come across the complication of HAI. It causes money, it causes a life of a patient, it causes everything. So we have also seen five types of HAIs. Let me know in the comment if you need any of the separate notes for any of these disease conditions discussed. And throughout the video, we have also discussed about your role as a healthcare worker, and how you could prevent the spread of HAI, or how you could minimize HAI. I wish you good luck, and like and share this video if you think it's gonna benefit any of you or your contacts in the nursing career. Thank you so much for listening.